Alright, so I posted a video earlier regarding nurses cheating their way through nursing school. And I don't know why some persons felt like, I was targeting some of our Jamaican nurses. And you and I know that, being a nurse in Jamaica or a nursing student in Jamaica, how hard it is to work towards getting our nursing license. It is so hard to cheat in that nursing exam. And I'm just going to tell you a little bit about our Jamaican nursing exam and why I say it's so hard to cheat. Because if you don't understand it, I'm going to explain it to you right now. Go ahead and subscribe to my YouTube page at ThinkNursing. Subscribe to it and be a part of the family. Alright? And let's get into the meat of the matter here. When it comes down to our system in Jamaica and how we go about with our exam, it touches on every angle you can think of. It's not just a multiple choice exam, just like the NCLEX here. And we know that multiple choice, everybody love multiple choice because you can always get your way through it. And that's where a lot of persons feel comfortable. So in the exam there, you'll see your med surg, your OB, your pediatrics, mental health. And yes, you might recognize some of the questions. And because we have past papers that go through, just like, the test bank. Yeah, and you feel confident about your answer. And this is where some persons feel, the confidence level for persons are a little bit better there. The next section of the exam is like your true and false. This is where we're going a little bit deeper. Here is where the problem is. There is no partial understanding in the true and false. It's either you know it or you don't know it. Yes or no. One wrong interpretation and you lose marks here, just like that. Alright, so that's multiple choice and you have your true and false. Then we have another section we call essay and short answer. And this is where many students get exposed because here nobody is helping you. You're sitting down at your desk and you're going to be writing. You'll be asked to explain something. You'll be asked to explain the management of like heart failure, appendicitis. And listen to me. You can't really guess the information here. You have to study it. You have to know the information. You can't copy it. You can't hide from it. You have to understand this information, organize your thoughts, and explain it clearly. And all of this information that you're going to explain is from the 4 years that you've been studying. You're in school. You're going to have to put that information down on your paper. So how is it that they're going to copy that information from somebody else that is sitting down next door? Well, not really next door, but beside you. Alright? Then you have another section of the exam that is called the practical part. And this is where things get so real because a lot of us will never really love that part. This is where you're going to actually perform. You're going to do the hands-on. You walk into a room, you don't know which patient you're going to be getting. You might do a wound care, catheterization, vital signs, medication, bed bath. There is some procedure that you have to do with medication administration, head-to-toe assessment. And while you're doing that, you have 3 examiners from different parts of the Caribbean that is there with you. And they're asking you questions like, why are you doing that? What complication are you preventing? So even if you memorize a step, if you don't understand what you're doing, you will freeze when the people ask you the question. So it's so hard for you to cheat your way through the nursing exam in Jamaica. This exam is designed to be so hard because of the constant supervision that you have. That is just it. It's not like the NCLEX that you sit down and you have a ton of, multiple choice questions that you're choosing from. You're not just there picking questions. You must be able to recognize, decide, explain, and act in the moment. The essays are going to expose everything. The essays, it's like your knowledge is on full display when you're doing the RENR exam in the Caribbean. The practical exam is live. Nobody can help you there. You don't have your phone. You don't have any notes. Nobody whispering and telling you, no, do it the other way. It's just you and your skill and the 3 preceptors over there that you don't know. You probably know one from your institution, but the other 2 you don't know. You understand? So even if you cram things, there's a possibility that the folks over there are asking you information because they're going to ask you, why are you doing this? And while them ask you, why are you doing this, you probably forget about something else. So the Jamaican exam, it tests what you know what you say and do, not just one thing. It tests every single thing at the same time. So that video regarding the cheating, yes, cheating, it happened everywhere. It happened everywhere. It's not only for nurses. It happened in any profession, doctors, everybody. You understand? So the message is struggle through your program. Don't rely on other persons to do things for you. Struggle because it's going to make you stronger in the end. But that video is related to the Nightingale, the Operation Nightingale that is active in the US right now. As I hear my accent and you hear that I'm from Jamaica, the video wasn't talking about my Jamaican nurses. So I don't know. I see some person saying that, yes, we hear about folks in this place and that place. Me don't know about any in Jamaica. I don't know. As I say, it would be so difficult for our Jamaican nurses to be cheating. It will be so difficult for them to be cheating because of how the exam is designed. Because it's not designed in such a way where, at least at the time when I was doing it, it wasn't designed in such a way where it was only multiple choice. Unless they switch it over and it's only multiple choice, then, you know, but me just say, at the time when I was doing it, it wasn't multiple choice based only. So the design it had at the time, and with the practical exam that I think is still, they still have the practical exam. It's so hard because it's not only one instructor at the time when you're doing your practical exam that will determine whether or not you pass or fail. And if you know pass the exam, the practical exam, there's no way for you to pass nursing school, because you have to pass the hands-on when those invigilators are there with you at the time when you're doing your practical exam. So my apologies, but at the end of the day, I do hope that you get the message. The message is that struggle through your nursing program. If you're going to take you 10 years to do it and get it right, at least you know that you earn it the fair way. Struggle through it, because your struggles will make you stronger in the end. At least you know the concept. When somebody said that this patient is crashing, when somebody says that this patient pH is 4.1, you know what exactly is going on with the patient, and you know what medications to run and grab without the provider listing to you what exactly they need. Because you would have been trained and you can critically analyze exactly what is happening. So I don't want anybody to take offense to the context of what I am sharing and thinking that I am trying to be rude, or may I try this up my own nursing colleagues. No. May I try to build them up as well, because I want us, when we go out there, we can still be strong, competent and safe nurses, because that is what we're supposed to be aspiring to be. I want us, when we get out there in the field, people can still respect us as nurses, not thinking that everybody that them see out there is a dunce. No, we're not a fraudulent nurse. Some of us, we stay up late at nights and study and struggle real hard to get to where we're at today. You understand? So I don't want it to be a case where we take the message the wrong way and feel offended that I am saying that nurses out there are wearing them nice good up scrubs. You understand? They must spend $1 million on them scrub and them boot and them stethoscope and them Stanley cup and them bag. I want us to do things the right way. Make sure you go through nursing school and you study real hard. You understand it's not all about just passing a course. You want to just finish the 4 years, or you want to just finish it in 2 years. You want to finish it, you know. You want to get the license, you want to get the degree, but at the same time you want to get it and still have the knowledge. Because if you don't have the knowledge and you just have it on paper, you will like a full nurse. You're going to be pretty dunce. We don't want that kind of nurse out there. We want to have safe, competent and smart nurses. That is the kind of nurses we want in today's world. And we still want professional nurses too. We're not going to leave that out. But anyways, big up on yourself to all the wonderful nurses out there, keeping it real and keeping it safe. And to all the ones that have struggled, just like myself, ball, you know, fail 1 or 2 courses and had to do it over, you know, show plate for clinicals, whatever it is. Continue doing you and continue staying true to yourself. So big up to yourself and continue to keep it real. And for all the persons who misunderstood the video, clear up on the mind and take it back. drop a comment down in the box below, and just share where you're watching the video from. And just share where you're watching the video from. And yeah, just share where you're watching the video from. And remember to go onto my YouTube page and subscribe. Alright, until then, I'll see you in the next video. Bye.